Here's Dr. Jan Mensink with answers to your common medical questions.
We see a lot of patients come into the office with back pain. And there's several things that the doctor needs to look at before he makes a diagnosis. And the first thing we do when we look at a patient is we try to find out is what's called a mechanism of injury. That's big words for saying, how did it happen? Because if we know how it happened, it can tell us a little bit about how serious it is, what the diagnosis is, and where to go from there. So the first thing we look at is what's called a mechanism of injury. How did this happen? If you, let's say, fell off the building, you were putting the Christmas lights up, you fell off the ladder, totally different story than somebody who got back pain that comes in and he's lifted the grandchild up and twisted their back. The back pain to the patient could feel the same and be in the same area the same, but totally different mechanisms of injury. And in fact, what the mechanism of injury will tell us in this kind of instance is this a muscular illness, or do I have to look at something underlying it? For instance, did you crush a vertebrae when you fell off the ladder? Totally different treatment, totally different workup, and totally different things that we do for you. So the first thing we look at is, how did this happen? Now often, be very honest with you, most patients don't really know. It's just sort of something insignificant had happened. First of all, when you come in to see us for back pain, we look at not only how it happened, but we want to categorize, is this a muscle pain? Is it a bone pain? Is it a nerve pain or a ligament pain or a joint pain? Because that tells us by your history and your exam what we have to do for you. There are several red flags that if you ever have this happen with back pain, you need to be seen right away. In fact, every doctor will ask you when you come in for back pain these two questions. Because they're red flags, because it means there's potentially very serious things happening. What are they? Number one, do you have any bowel or bladder incontinence? If you have trouble and you can't control your urine or your stool, you've got to see your doctor right away. Number two, if you have weakness in your, let's say, your legs or your muscles. Now, it's very different. A lot of people say, well, I feel weak, but they really are weak because they hurt. That's not weakness. I'm talking about weakness where the muscles are weak. Let's say you've got to have a foot drop or something like that. The last thing that we look at is this what's called a radicular pain? And what that means is, are the nerves involved somewhere? Because if the nerves are involved, you can still have tremendous muscle spasms and the muscles can be all bothered. But if the nerves are involved, that changes my treatment options to different medicines. Nerves that are injured and traumatized, and the typical example is sciatica that everybody knows about, where you have pain going your back or your hip, going down your legs. That's the typical nerve pain. That's sciatica. And it comes in all sorts of forms. By the way, it also can have no pain. You can have sciatica with no pain going down your legs, but just in your buttocks, in your cheeks of your buttocks, severe pain. That's sciatica also. But the key for the doctor to know if it's a nerve pain is these are treated with usually different kind of medicines. And it makes a major difference. If it's a nerve pain, if I treat you with the right medicines, usually steroids and very strong, powerful muscle relaxants, for a short period of time, 4 or 5 days, it can be like magic. I have had people come into the office and they can barely crawl in. And 5 days later, they think you're magic because you diagnosed what was a nerve pain and treated it correctly. But if you treat a back pain that is a nerve pain that has lots of muscle problems and treat it as a muscle issue, it may not respond as well. The last thing that's important is if you have a nerve pain and it doesn't get better with simple things, it needs to be looked at, especially if you get loss of function or you get bowel or bladder incontinence. Those need to be imaged early, not late.